Okay, if you notice that your cat is starting to look a little bit dry, it's a good idea to spray the cat down with preservative. We are using what's called Ward Safe, which is a well, we are using what's called Ward Safe, which is a water-based preservative. And you'll notice that I'm just gently spraying it all over the cat. This is going to help keep the tissues from drying out and becoming brittle. So we want to just, liberal spray. Make sure that you do this at least every hour, if not more frequently, depending upon how dry it is in the room. As you can see, we have both of our vascular bundles on the left side of the cat and the right side of the cat exposed. These are going to be our guides for opening the thoracic cavity. What I like to do is actually use my blunt probe as a shield. Just deep to the ribs, we would find the heart, the lungs, and a large grouping of arteries and veins. So using your blunt probe, gently start to probe the area where you see the blood vessels passing through the chest wall. I'm not going very aggressively here. I want to just do it nice and gently. And you want to try to keep the tip of the probe up. If you go in with the tip down, there's a chance you could catch those blood vessels. So I'm just going in with the tip up and just slowly working my way through. What we want to do, or what we want to see is that probe coming through the other side of the chest wall. Once that probe is through the chest wall, we know that those blood vessels just deep to that probe are going to be protected, and we can use the probe as a guide to open up our chest wall. And there we go. So the probe is through the chest wall. I'm just wiggling it a little bit more. I'd like a little bit more of the handle in there. And there we have it. Now that's going to be our guide. Now we need to remove the remaining muscles from the chest wall so that we can get as close to the ribs as possible. And I'm just going to use my 10-blade scalpel. We want to try to follow the line of the rib cage. We don't want to get into the abdomen just yet. We've got a lot of organs in there that could potentially dry out. So we're going to get into the abdomen last. So for right now, I'm just going to follow the line of the rib cage and just cut the muscles down, and then use the scalpel to gently shave that muscle off. So I'm keeping the edge of the scalpel elevated, keeping it pointed up towards the muscle. That way I don't accidentally dig down into the rib cage. So pop that little bit out right there. So I'm just taking and I'm just using the scalpel. And you can see I really don't even need to use the scalpel. That fascia is very soft underneath, and it will come out pretty much with just a little bit of force applied. But if you run into some difficult areas, you just gently run that scalpel right along that fascia, and you can see it comes off with no problem. So now we have this nice big piece of muscle here. We can go ahead and trim that off. We are going to do the same thing on the other side. Just follow the line of the rib cage, trying to stay away from the abdominal cavity. Get our scalpel underneath. Try to get a little bit of an edge that I can lift up on. There we go. So we're just going to then use the scalpel to shave that muscle right off. This is an important step. The bone nippers are really good at cutting through bone, but not really good at cutting through soft tissue. So the more of the rib cage you can expose, the better. Also, to help out, we can make a couple of reference lines. So I'm just using the scalpel to follow down to our cut, about a 1/4 inch on either side, the costal cartilage. So what I've just done is made a reference cut over the costal cartilage all the way down to where we had removed the rest of the pectoralis muscles. Sometimes it is a little bit easier to get through the ribs if you were to come down and also cut off this tissue right here. So we're just trying to get as close to the rib cage as possible. Sometimes the bone nippers will get through this little additional soft tissue with no problem. Sometimes they will tend to get hung up. So I'm just showing you this. You can try using the bone nippers as is without removing the muscles on the lateral side of the thoracic cavity. But if you're finding yourself having a difficult time getting through the ribs, then you definitely want to take that little bit of extra muscle tissue off. Okay. So now we're going to open the thoracic cavity. We're going to use our large scissors, and as you can see, one end of the scissor is pointed, the other end is curved. We are going to use the pointed end of the scissor to poke our way through the rib cage. You do not want to force the scissors through the rib cage because our lungs are just deep to it. So what you want to do is just insert the tip enough to catch the costal cartilage. And you'll know when you've got it because you'll see the rest of the rib cage elevate. There we go. See, I'm underneath one of the costal cartilages right now. And what you want to do with the tips of your scissors pointing up as much as possible, you want to cut through that costal cartilage. Now, it can be a little bit tough using the scissors, but remember, it's cartilage, it's not bone. So we're not going to need a whole lot of force, and you may need to reposition after each cut because the scissors tend to come out. So again, I'm doing my best to lift the tips of my scissors up, putting some upward pressure on the rib cage, and then cutting, which is why you see the scissors flying out each time I make a cut. There we go. We want to try to get as close to that blunt probe as possible. And as you can see, I'm almost all the way through the chest wall. I may need to go through with the scissors again and just try to get some of that muscle tissue out of the way. There we go. And it happens. It's okay to do that. Again, I'd much rather you have to cut shallow twice than you cut too deep once. Now I am into the thoracic cavity, and in just a minute we'll be able to see the heart. So we're going to do the same thing on the other side. Push the scissors through, elevate the tips, and just cut. Scissors through, elevate the tips, and cut. It almost sounds like clipping toenails. I'm just getting my finger underneath the sternum to give me a little bit more room. So I'm cut, elevate and cut, elevate and cut. Getting as close to that blunt probe as possible. Okay, so now you can see I have the sternum completely loosened. I'm able to get my finger underneath. Now what I'm going to do is come down to the distal end of the sternum, and you should be able to use the scissors for this. If not, the bone nippers will work, and I think I'm going to try the bone nippers just to show you. You want the flat side of the bone nippers towards the abdominal cavity. I'm going to insert those through, use 2 hands, and give it a nice cut. Now again, we have a lot of soft tissue down here. So what you heard was actually the bones crunching or cracking, which will make it a little bit easier for the large scissors. Get that positioned right there. Make it a little bit easier for the large scissors to actually work their way through. And there we go. Next, you want to elevate the sternum, and you will see a couple of blood vessels on the posterior surface. You can see them right there. These are your sternals, your sternal artery, sternal vein. We're not really going to concern ourselves with them too much, but I just want to get that sternum elevated. I want to get it pulled out as far as I can, and then once again I'm going to come in with my bone nippers. And there we go. Once the sternum has been removed, we can spread the ribs a little bit and be able to identify the mediastinum. The mediastinum is the layer of connective tissue that helps to secure the heart within the thoracic cavity. We can also start to see the lungs. That little bluish area right there are the lungs. Now this is not enough space for us to work in. So what we are going to do is come back with the bone nippers again and remove some more of the ribs. What I found, and this seems to work very, very well, is you take your scalpel and you line it up with the opening for the blood vessels where they're passing through the chest wall. Apply a little bit of pressure. You don't want to go too hard because it is possible to actually cut through the ribs with a scalpel. But what you want to do is you just want to make a reference line. And we're cutting through some of the soft tissue so that we can get the bone nippers in there and cut those ribs away. So once I have my reference line, I'm going to go back to my large scissors, and using the curved end, I'm going to find the intercostal space and just cut down to my reference line, the one that I cut with the scalpel. And we do want to be careful because the diaphragm is right in here, and we're not going to talk about the diaphragm for at least a couple of weeks. So we want to make sure that we try to keep that diaphragm intact. So I can see a portion of the diaphragm. So I can see a portion of the diaphragm right there. The lung and the heart. So once I get my, you could do this with a scalpel too if you wanted to, just cut through the intercostal space. But once I get down to my reference line, I'm then going to use the bone nippers and just one rib at a time cut the rib cage away. Don't do more than one rib at a time, because you end up crushing them, leaving some jagged edges that could cause a poke injury. So there we go. I now have the rib cage on the right side of the cat cut away to where our blunt probe is going through. And now I'm just going to very carefully use my scalpel to cut that away. We're now going to do the same thing on the other side of the cat, again, using our scalpel, cutting a slight reference line down to where we cut the muscle out. Scissors, and just following that intercostal space. Down to our reference line, and then using our bone nippers to cut away the ribs. And there we go. One of the first things that you may notice inside of the thoracic cavity is that there is some dried blood. That's what all of this is. So at this point, you're going to want to stop your dissection. Take the cat over to the sink and rinse out the thoracic cavity. So gently transport your cat from your station on its dissecting tray over to the sink. Rinse the cat out with cool water and then bring it back to your station. After rinsing the cat with cool water, we definitely want to spray it down with Carosafe again to help preserve those tissues. Once you've rinsed the cat with cool water and sprayed it down with Carosafe, the next area that we are going to focus on is the area around the manubrium of the cat's sternum. Once we've rinsed out the thoracic cavity with cool water and sprayed the cat with Carosafe, the next area that we want to focus on is around the manubrium of the cat's sternum. Just deep to this structure, we are going to find a large collection of blood vessels. The best way to approach this region is by using your small scissors and your blunt dissection technique. Laying your scissors as flat as you can on top of the heart, insert them just deep to the manubrium, and then spread that, and then spread the scissors apart. Again, you want to try to keep the tips of the scissors pointing up as you are doing this. And we are working our way, believe it or not, following the line of the cat's trachea. So I'm just inserting the scissors, spreading them apart, inserting them, spreading them apart, just trying to loosen that tissue up as much as possible. I also want to go a little bit laterally so that I can loosen up the tissue where the blood vessels are. And we can start to see how that blood vessel is tracking into the thoracic cavity. So take my small forceps here, small tweezers, and just start pulling and cutting some of that tissue away. Now I may need to come back in with my bone nippers once I've made sure that I have a clear line through that opening. Take my bone nippers and just take that right off. And once I've loosened up the tissues, the manubrium of the sternum should just fold backwards. And now we're loosening that up. And I'm going to, again, continue with my blunt dissection technique. What I want to do is be able to remove this entire section, because just deep to this tissue we'll find our external jugular veins and our carotid arteries. I'm going to switch to my larger forceps since I'm dealing with a bigger piece of tissue. You could also switch to your large scissors, but I would recommend against that because, again, your carotid arteries are just on either side of the midline of the trachea. So there we go. Okay, I've got my scissors. They're all the way through, so I know that that's safe because I've stayed as close to the tissue as possible. So now I'm going to get my scalpel and, using my scissors as a shield, just make a midline cut and get through that tissue. So as long as I've got something underneath this, I'm not going to risk cutting the trachea or cutting any of the blood vessels that I would find just deep to this tissue. Okay, now I'm coming in through the little opening, or what's left of it. Actually, I think I'm going to take some of this tissue off. There's some tissue that's holding on to that vein. So I'm going to come in and just start blunt dissecting that away. Trying to get as much of this tissue off as possible before I continue my cut, because the more play you have in the tissue, the easier it will be to eventually take everything off. So see, we've got a lot of tissue attached over here. Now as I start to break through this mediastinum, don't be alarmed. There might be some pockets of preservative still in there, or you may run into some areas of dried blood. I just want to clean up as much of that as possible to give me a better view as I work my way a little bit farther up into the neck. There we go. See? Blunt probe, more often than not, is going to be your friend because this tissue is very fragile. Once we break into it, it should come away from the blood vessel with very little problem. I think we've removed enough of the soft tissue away from the blood vessels here to safely cut away the rest of the sternum. We can start to see right here where the external jugular vein is going to work its way from the head back down into the thoracic cavity. So once again, just using my blunt dissection technique, inserting the scissors, gently opening them to help work away some of the tissue from around that vein. So once I've made a hole through the tissue with my smaller scissors, I can take my larger scissors, insert them, and cut that tissue away. And there we go. There's our external jugular vein. So we are going to continue this process following the external jugular vein up through the lateral portion of the neck. Let's continue our blunt dissection. The cat's thyroid gland would be located in this region. We don't cover the thyroid gland until we hit the endocrine system. And unfortunately, during this portion of the dissection, the thyroid gland ends up getting destroyed. So as long as you are not cutting away a blood vessel, any other tissue that you may find in this region can be taken out. So as you can see, I'm working my way up through. I have my hole, stick my small scissors in, and now I'm exposing more of that jugular vein. So it will just be a process of doing your blunt dissection, working your way up along the lateral side of the neck, exposing more of that vein as we go. And once you get the majority of it exposed, we can use our blunt probe to start removing the surrounding tissue. It is a tedious process. It does take some time. But again, the more time you take prepping these blood vessels, we can see a couple of small tributaries here. Those can go. The more time you take prepping your blood vessels, the easier they become to identify. The more time you take prepping your blood vessels, the easier they are to identify later on a practical exam. So I'm just using my blunt probe and my tweezers to try and get some of that tissue away from the external jugular. Now the carotid arteries are going to be just on either side of the trachea. So in order for us to be able to find those, we have to remove the tissue from the midline of the neck. And so we are going to come up here and cut a little bit of this away. Again, trying to avoid that jugular vein. Going to use our scissors to do our blunt dissection. And what you should start to, you'll probably feel it before you actually see it, but there is a rigid structure right here. That rigid structure is the cat's trachea. So we do not want to cut into that just yet. So back to the blunt dissection. Just very gently lifting and separating these tissues. And if everything has been done correctly, we should be able to find our carotid arteries. Coming in on this side might be a little easier to find. Take some of that tissue out of there. Okay, this one's playing hide and seek with me. I'm having trouble finding it. Now, if you are having trouble finding these, we can always come back and try to find them as they come off of the arch of the aorta, which would be up here. So we'll just search around for a little bit longer. I'm hoping that they took. And when I say that, it means I'm hoping that the latex that was injected into the cat actually made it into, there it is, the carotid artery. This is our common carotid artery. Just taking that tissue away from it. And this is what will eventually split off into our internal and external carotid arteries, supplying the structures of the face as well as the brain. So there we go. that is our common carotid artery. Now you will find nerves passing just lateral to it. That's fine. We're going to keep those intact for right now. And just work to clean away the tissue. So in this region, what you want is to be able to follow the external jugular vein as well as the carotid artery as far up into the neck as possible. So I am going to take some time to clean these blood vessels. This is part of the deltoid muscle that's coming out. So we're just going to take some of this off. As you're taking muscle tissue off, it tends to get, I think it hit the clavicle. I'm going to switch to my, let me switch to my larger scalpel here. There we go.